In discussions of healthcare reform, the Canadian system is often considered a potential model for the U.S. Despite differences in funding and structure, both countries share cultural similarities that suggest the U.S. could adopt the Canadian system. Canada's single-payer, publicly funded system provides universal access to healthcare, while nearly 1 in 5 non-elderly Americans lack insurance. Canada spends less of its GDP on healthcare, but outperforms the U.S. in health outcomes like infant mortality and life expectancy. /mdir.org/fall07, comparing U.S. and Canadian healthcare systems. In a study titled Health Status, Healthcare and Inequality, Canada versus the U.S., authors June O'Neill and Dave M. O'Neill compare the performance of the U.S. and Canadian healthcare systems. They investigate whether the Canadian system delivers better health outcomes and distributes health resources more equitably than the U.S. The authors note that factors beyond the healthcare system, such as behavior and lifestyle choices, can impact health outcomes like infant mortality and life expectancy. At /nbar.org/fall7/compare and Canadian healthcare systems. For example, low birth weight, linked to substance abuse and smoking, is more common in the U.S. If Canada had the same proportion of low birth weight babies as the U.S., it would likely have a slightly higher infant mortality rate. Similarly, differences in life expectancy among young adults are influenced by higher rates of accidents and homicides in the U.S., while heart disease-related mortality at older ages may be linked to factors like obesity rates, which are higher in the U.S. than in Canada. On s/www.org/bog/07/comparing U.S. and Canadian healthcare systems. To further compare health outcomes, the authors analyzed data from the Joint Canada-U.S. Survey of Health, which surveyed about 9,000 residents of both countries in 2002-2003. They assessed self-reported health status, recognizing that this measure is subjective and influenced by factors beyond the healthcare system. Despite these limitations, self-reported health status can provide valuable insights into how individuals perceive their own health and well-being. https://dar.org/fall7/comparing U.S. and Canadian healthcare systems. Overall, the study suggests that while the Canadian healthcare system may offer advantages in terms of universal access and cost-effectiveness, differences in health outcomes between the U.S. and Canada are not solely attributable to the healthcare systems themselves. Factors like behavior, lifestyle choices, and social determinants of health play significant roles in shaping health outcomes in both countries. As the U.S. considers potential healthcare reforms, it is important to consider these broader factors and their impact on health disparities and inequalities.